coming up because at the last year, when we had the forum, we instructed folks to go back and work with their communities and identify who their stakeholders were. And a lot of folks have already been doing wonderful things, but it's growing. And we just want to give as much of an opportunity as we can over the next couple of days to hear what's happening and what people are doing in their libraries. So, the person I'm going to bring up now is Amanda Marti. Where are you? There you are. Yay. Who is the director of the UCP, that's United Cerebral Palsy Heartland Center for Autism. And welcome. Thank you.
Thank you, Suzanne. After we left the Targeting Autism Forum last March, Sherry and Ashley and I were so excited and ready to get started. And I think within a couple of weeks we met and talked about some other people that we would like to bring on a committee with us to do a community needs assessment. And so we just got that started right away. Then on April 1st, I'm with one of the centers that was a member of the TAP program. And on April 1st, I got hit with, your funding has been discontinued, cease and desist, do not spend any more money. And it really crushed me because like Deborah was saying, so many families will go to the doctor and get that diagnosis of autism and be given a brochure and then be just turned away. You're on your own now. And I was able to be that person that could say, you're not on your own. We're here to help you. And we're going to walk you through this, and we're going to connect you to whatever resources are available. So again, I was so excited that the libraries were going to be joining us and that I was part of this project. And I was really crushed. So we advocated for the rest of that month and did get our funding back through the end of June, but our center has gone on unfunded since July 1st. UCP Heartland has been generous enough to use money out of the reserve accounts so that we can keep the center open, but without a state budget, I can't see that happening much longer. So again, thrilled that libraries are coming on board with us because I'm sure there are a lot of responsibilities that the centers are going to have to turn over to the libraries and really require those community partners to be that hand holding for these families as they get this news and don't know where else to turn. So you can flip to the next one. So this is a list of some of our community members that came on board with us, and Maggie Henderson has joined us at the forum this time. She's with Glen Carbon Library. And Sherry Krause is here again also. One of my staff members, Amy Becker, who is a developmental therapist, joined us on the committee. Liz McKinney, a professor at SIU Edwardsville. And Jody Neert from Roxana School District. And then Ashley Bryant changed jobs shortly after attending the forum last year. She wasn't able to stay with us. And then the next slide is just a chart of different people who we determined were stakeholders in our community. We put together a list of all people that we knew and ways to get the information out, and invited the members of our community to join us. Maggie offered some spaces within her library one evening, and so we started inviting people and requesting that they attend this needs assessment. For the needs assessment, we asked the participants to identify services and supports for ASD that already existed in Madison and St. Clair counties, to identify service gaps in those counties, to prioritize the needs for services and supports, and then identify ways that libraries can connect families to their supports and be more welcoming. Okay. So for the residents with autism in our community, these were the people who attended, and one of the discussion points was, is your child receiving services? If so, if they've received services, gone through college, and gained employment, is that a result of their college education? And we found that not necessarily so. Usually the individuals who had gone on to their adult lives and gained employment, it was through the help of their parents, and their parents supported them and helped them. So that support is something that was needed in the community. And then the next one is the number of people receiving services for ASD, and majority of the children were receiving some type of service, even if it was just within their schools, but the older teens and adults were not receiving services. And I'm not going to go through the whole next list, but the next slide is services that the families were receiving. And they mentioned services available in the community, but not necessarily ones that were available to everyone, usually due to funding. Or Deborah mentioned the PUNS list. So in order to receive funding to receive services as an adult in the community, you need to be identified on this PUNS list and chosen from the list to receive the funding. So it's basically a waiting list, and there are many, many people waiting. So we looked at the needs that families and service providers identified existed in the community, and the highest priority, time and time again, it came up that training was a need. Community businesses, employers, all needed to understand autism so that they could provide the service or provide employment for individuals with autism. Law enforcement and other first responders needed the training so that they could respond appropriately when called in an emergency situation. Health professionals needed the training so that they knew how to interact, serve, and treat individuals with autism. Parents and family members, again, they're given a brochure, your child has autism, here's the door. They're not given the information. So that while we're providing that at the center, parents need more of that, and they need ongoing training as their child goes through each phase of life. Educators and other school faculty, so not just the teachers, but everybody on site, from the support staff in the front office to the janitorial staff to coaches, everyone within the school needed the information so they could, again, support these students with autism. And direct service persons, so personal assistants working with individuals with autism spectrum disorders need to understand what autism is, how a person with autism thinks, and how to best support their needs. And then they also talked about some special library programs, life skills training, life coaching was big, parent support groups, and improved disability services at universities. Other support needs that were important but not such a high priority were adaptive sports programs, book or study clubs, employment. I'm surprised that one wasn't higher on the list. Job coaches, job skills training after high school, mental health services and counseling, mentoring for parents, children, and young adults, more specialists serving people with autism spectrum disorders. Some wanted self-contained schools, which was one that surprised me. We're working so much towards integration, but some parents feel that their children have such specific needs that self-contained or individualized services for autism were important to them. And therapy dogs. And then some of the less mentioned items, but still mentioned by some, they wanted agency informational brochures in libraries. They did want to be able to go to their libraries and find that information there. Alternatives to classrooms. So maybe a classroom setting wasn't what worked for their child, but another type of setting did. Bullying prevention, They wanted the library to share with them a calendar of events, a community board, somewhere that they could go to find places where they would be welcomed in the community and give them some activities for their children. Cross-state communication. We're on the area of Illinois that is very near the border to Missouri. We're right across from St. Louis, but yet our services don't flow back and forth. The communication doesn't flow back and forth, so they'd like to see more of that. More diagnostic professionals. A diagnosis for autism can take 6 months, even up to a year sometimes. Inclusive playgrounds. We have a sensory playground in our community, and there was one special swing that they mentioned that's a very popular swing, but not enough of them, so they want more swings. And they feel that people who need training should maybe have incentives to receive the training. And I think this was probably aimed at the first responders or someone along those lines to have some kind of incentive to learn more about autism. And then more interventions or treatments in school. ABA was one, and then a new emerging program that some parents are starting to use is the Gemini program. So one mother was really stressing the importance. She felt that it's worked very well for her child, and she would like to see that in school. Job development, job fairs, library skills training, media recognition and promotion of events. So again, so that families know where events are available for them. They want the media to start picking up on the importance of sharing this information. They want mentors and respite. Respite's another one I'm surprised wasn't higher on the list. They want that social interaction. They want teen social groups. They would like to see university volunteers going into the schools and more venues available for inclusive activities. So the next thing we asked them was how their library could be a conduit to support, to tell them and share information about what services and resources, how to connect them with those things. But first of all, they want their library to be inclusive. One family did say that I don't bring my child to the library because the library is the place to be quiet, and he's just not able to be quiet. They want the libraries to have collaborations with their schools, and they want their doctors to refer them to the library for information. They want the library staff to be able to assist them in finding the resources that they need. Often these parents, when they're first given that diagnosis, don't even know what questions to ask. And so if the library staff can guide them to this information they know they will need, that would be helpful. And they would like to see libraries offer internships or positions in the library, and I think that was brought up already today, that the library is a great place for people who like to organize and put things in a certain place there. It's a very good place to provide that kind of employment. They would like libraries to have some hard copies of resource manuals so they can go in and they can look up who is a doctor that serves children with autism, or what dentist should I go to. Or if not hard copies, maybe an online database that they can connect to. And I think there was also mention of that database being available on a library website. Calendar of events, again, similar to that board or postings of events, but also including workshops and trainings that families can attend. One idea that I thought was very interesting was to have a tech mentor in the library so that the parents can take their children in there, and there's someone that can share with them different types of apps to use, or how to use technology, how to use those things to help their children learn. And then just again, more about a database of resources. They're just looking, they need that hub, that one single source of information that they can know they can always go to and find what they need. And then they also would like the library to hold more community meetings. They really enjoyed having a chance to come into the library and talk about what they wanted and needed as parents, and they would like to see more of those, and for the library to be a home to groups, support groups, social skills groups, and those kinds of things. And then they talked about how libraries can be welcoming to residents with autism spectrum disorders. The first thing that came up, or the biggest thing that came up, was to have those sensory rooms, the beanbag and rocking chairs, some sensory toys, an aquarium is calming, maybe some soft music, a ball pit, water play, tents, and Maggie said they do have some tents that the kids can crawl into and be alone for a while and have that quiet space, a swing, a rocking chair, things like that. Somewhere that noise is not an issue, somewhere that they can go with the child if the child is being loud, so they're not disturbing the other patrons. They would like that kind of a space. They want the face-out areas of children's library to be less intimidating, so rather than rows and rows of the book spines, they're actually seeing some books facing out, and they're easily able to identify books that they're interested in. Some visual supports to be available in the library so that they can increase their independence, so they can look at those supports and maybe find their own way through the library, or be able to use those supports at home for dressing or their other parts of their daily routine. Social stories, noise canceling headphones. I'm not sure if that was for the children with autism or for the other patrons when the children are being loud, but I guess that would work either way. Again, the tech guru for gadgets, iPods and iPads to be available. An introductory kit for libraries, or a guide with pictures, which is something that TAP has made available, and I think that's still on the website. Do you know, Russ? Yeah. Last time I looked, it was still there. So if you go to the TAP's website, I think it's listed under accessibility, and it was made for the Chicago Public Library, but you could adapt that to your own library. And it's a step-by-step walkthrough on what you do in the library, how to find things, how to check out books, how to use the computers. So we let them know that there was something similar available. Video modeling or introductions to the library, and Maggie is working on one of those. It will soon be up on the Glen Carbon website. She showed me her beginning stages of that, and it's a step-by-step. She's taken pictures of the outside of the library, walking through to the door, all the way up, walking through the library to the children's section, so they'll know before entering, and they're prepared for what's going to happen, so they don't walk into the library with anxiety for their first visit. And I'm really excited and can't wait to see that up on the website. They want DVDs and books about autism, and I would also suggest the audio books. A lot of times parents have a lot going on and no time to read. Those audio books are great to stick in the car and listen to while driving. And then they want computer availability. They would also like to see some events at the library, some kind of inclusion evenings when they know for sure that their child is going to be welcomed and accommodated for with whatever program is happening. Again, the same with the specialized groups. Signage or labels, ways to identify areas of the library, easily identify those areas so they and their children know where to go without walking down rows and rows of books. And avoiding sounds like bells or chimes. I've got my sign that I only have 5 minutes left, so I think the procedures kind of go along with the same theme on easing the parents' discomfort through Maggie had come up with the idea of when a parent has identified their child has an autism spectrum disorder, have a checklist and kind of ask, does your child need this, or what are their needs, or just some kind of getting to know you type of document so you can get to know that child better and accommodate them within your library, and then the parents are comfortable bringing them there. Being able to explore the space, giving them an orientation, so walking them through the library when they arrive their first time. library staff training. Again, back to that training, which was so important, and we are starting to offer that in our area. Maggie has had me come in and do some training for her staff, and Russ came in and trained many of the children's library directors in the area, and we're continuing to provide that service for libraries so they know more how to serve those patrons. Since I only have a few minutes left, does anyone have questions about our needs assessment? Okay, I'm just going to list off a few more things that are going on, at least at our Glen Carbon Library. They're doing gaming nights. Maggie visits summer camps for children with disabilities and does a book reading and a craft project for them. They have therapy dogs come into the library so children can come in and read to the dogs. I talked to you about the video introduction to the library. She does tutoring. There are some college students that come in and offer one-on-one private tutoring for students in the library. They do sensory story times. And I've already told you about that we're doing some trainings in our area. So, Suzanne, if you could flip to I think it's my very last slide. Just because I like to see, ooh, look at all the pretty colors. But this is a chart of all of the different zip codes that are served at our center. And when I did this, it really resonated with me that families are not grouped together in one zip code. They're not easily able to find each other. They're all over the place, and libraries can be an excellent source for a place for these families to come together and find those resources that they need.